This event is co-organised with Hand in Hand for Aid and Development, the Syria Public Health Network and Health Professionals for Global Health. And the title of this webinar is Post-Conflict Healthcare in Syria, Navigating Challenges and Identifying Solutions. My name is Ula Abbara. I'm a trustee for Hand in Hand for Aid and Development. I'm co-founder for the Syria Public Health Network, and I work as a physician in the UK. The reason we put this webinar together today is that we are at a seminal time in Syria's history and its health system. As many of you will know, 14 years ago, Syria's population rose against corruption and persecution, leading to among the most devastating of protracted conflicts anywhere in recent history. Up to 40 to 60% of healthcare facilities are not functioning or partially functioning even now, and thousands of healthcare workers have been forced from their homes, either as internally displaced healthcare professionals or beyond Syria's borders. More than 900 healthcare workers have been killed, and Syria's health system has faced more than 600 attacks on healthcare. What this has meant is that we have a health system that is beleaguered, that is fragmented, and there are multiple ways of working across Syria's geographies. After the fall of Syria's regime in December 2024, Syria now stands at a critical crossroads, and there are opportunities now to understand the health system in this post-conflict period and to see how organisations like Hand in Hand for Aid and Development and others are able to support the reconstruction of this vital asset to Syria's health and Syria's population. We now shift from humanitarian and emergency operations to opportunities focused on long-term recovery, on reconstruction, and on sustainable system strengthening. And so in this webinar, we will address the current state of Syria's healthcare infrastructure from people directly inside Syria, or all of our panelists have recently been visiting, and barriers to recovery and opportunities for reform, and the role of Syrian healthcare professionals and institutions in reconstruction. And we will focus on practical and policy recommendations for sustainable healthcare development. And we will do that through the voices of our experts on this call, who spanned academia, who spanned clinical and humanitarian work, and also those who work in the healthcare systems across the world. So I've got great pleasure in introducing our panelists today. We have Fadi Sahlul, who is founder and CEO of Hand in Hand for Aid and Development. We have Mohammed Al Abbas, who is the country director for Hand in Hand for Aid and Development, and who is a physician himself. We have Salahuddin Sawan, who is a gynecology oncologist based in the UK, but who undertakes extensive humanitarian work in Syria, Gaza, Libya, and elsewhere. And last but not least, we have Ellie Knott, who is the co-founder of the David Knott Foundation and a PhD candidate at King's College, examining Syria's health system over the last few years and in its current state. Mohammed, can I go to you next? Could you tell us more about the work that you have been doing and what you have seen that has changed perhaps before and after December 2024, and what the current health system looks like through your eyes at this time?
Yeah, thank you, Ola. Thank you for the list and for the attendance for this webinar. So first, yeah, I've been with Hand in Hand now since 10 years now. I start with Hand in Hand as a medical coordinator, long journey full of learning experience, but also with a lot of challenge, a lot of sorrow, and a lot of pain during this journey. But alhamdulillah, now we are here after December and the falling of the regime. So what changed? It's a huge change. It's a new era for Syria now. But it's come also with huge change. I will borrow from the last report from NRC they've been talking about devastating infrastructure and lack of basic service, and now in Syria after the war, we have destroyed schools, destroyed hospitals, and infrastructure. It's almost collapsed. We have also economic collapse and significant livelihood challenges for the people to recover from economy. And of course, we have other like challenge with the safety and the social cohesion concerns, huge concern after you know what happening for the community after that. So of course, it's an era of hope, an era of like you know optimistic, but also with huge changes, huge challenges. That's when now we want to also to manage it. Currently, for example, in the health system, we have more than 11 in Northwest Syria only. We have almost like 1,700 two health facilities experiencing like a huge gap funding now as end of May. So I will stop here, just like maybe.
Cool. Thank you very much, Mohammed. And I know many of our audience are familiar with this, but Syria's conflict has forced more than half of the pre-conflict population of 22 million from their homes. Around 6.8 to 7 million are internally displaced, and the remainder are, many of them are refugees or have had to leave Syria's borders. What we do know is around 400,000 people have returned to Syria, mainly because the situation in some of that they face in Lebanon, in Turkey, may be even more dire than the situation that is faced inside Syria, because we must leave no doubt, despite the hope that many of us feel, that much of the infrastructure is destroyed. And people who are internally displaced, for example, in northwest Syria, may return to visit their homes in Aleppo, Homs, Hama, and see what is there. Often they find there's no schools, there's no healthcare, there's no infrastructure. So they return to where they are internally displaced, for example, in the northwest or elsewhere. What that means is that there's a long road to recovery for infrastructure and ensuring adequate healthcare services for the population.